afternoon, ma'am. Good afternoon, ma'am. I'm Jessica Valdez from BSN11, and I will be going to perform the Retdem demonstration for the administration of oral medication. So the purpose of this procedure is to provide a medication that has a systemic or local effect on the gastrointestinal tract. So first, for our assessment, we need to assess for the client's level of consciousness and ability to understand instructions. So how are you, ma'am? Okay po. And then next is the client's vital signs, especially the respiratory rate, the pulse rate, the blood pressure, and the temperature. So theoretically, I've got already those vital signs, and the result is all normal. So next is the if the patient has nausea or vomiting. So ma'am, feeling niyo po ba nasusuka po kayo or hindi naman po? Okay po, that's good. And then next is our if the patient has a gastrointestinal motility. So meron po ba kayong reduced gastrointestinal motility po? Okay, that's good po. And next is the patient's ability to swallow. Okay naman. Okay po. And then next is recent diagnostic of surgical procedures. Ma'am, nag-undergo na po ba kayo ng operation or surgical procedures? Hindi po. Okay po. And then next, if the medication has an unpleasant odor, so wala naman po, normal po yung gamot natin. Also, the expiration date of the medication is, I've already checked a while ago, which is 2025. So, it is safe to administer the medication orally. And then, next is the history of allergy to certain medication po. Meron po ba kayong history of allergy? Wala naman po. Okay po. And then, next is the color and appearance of our medication, and also the intactness of the wrapper of our medication. So, it's normal naman po. And then for our planning, observe the 12 rights of giving medication, and especially the 6 rights of medication, which is the international standard, which is the right client, right medication, right dose, right time, right route, and right documentation. Next is to do hand washing before and after the preparation of our materials. And then prepare the following materials, which is our hypo tray with a lining, our medication prescribed by the attending physician, also our medication glass or cup, our medication card, which is, it says, ascorbic acid, vitamin tablet, 250 grams, and the route is orally. And then, so this is our medication card prescribed by the attending physician. And then next is the glass with water. Also, our straw if the patient cannot drink water directly from our glass or cup. And then next, for our implementation, you need to perform hand hygiene and put on PPE if indicated. And then next is to introduce yourself and verify the client's identity using 2 identifiers. So, good morning, ma'am. I am Jessica Valdez, your nurse for today. May I know your name, ma'am, please?
Ruby Rose M. Miligrito.
And then your birthday po?
January 27.
Okay, that's good po. So, I will be going to ask you to do some tasks for me. Please do follow my instructions well. Okay, that's good po. And then next is to because the rationale behind this is this ensures that the right client receives the medication. So next is place the hypo tray in the bedside table po. And then provide for the client's privacy and safety, including the proper positioning of the client, whether sitting, side lying, or supine position. So comfortable naman po kayo sa sitting position niyo, ma'am. Okay, that's good po. And then next is putting the side rails. Theoretically po, in kapag nasa clinical setting na po tayo theoretically po. And then next is to spread the curtain before and after the procedure or closing the door. And then next is to place the call light in which na re-reach po siya ng ating client. So, theoretically din po kapag nasa clinical setting tayo, and then put down the side rails where we will work, and then assist the client in a sitting position. If not possible, lagay po natin sa sideline position to prevent aspiration po. So, comfortable naman po kayo, ma'am. Okay po, that's good. And then next is to place medicine in a glass or cup. And then dispose na po natin on our container po for solid materials. And then next is to offer the medication to the client. Ayan, give 1 capsule at a time po if there are more medication that is given po. And that should be taken by the patient. And then give the client sufficient water or prepared juice to swallow the medication. Ayan po. And then, kaya nyo po bang inumin or gusto nyo po ng straw?
Kaya ko na.
Okay po. So, if the patient cannot drink water po or nahihirapan po siya uminom through the glass, we need to offer some straw po. And then, ayan po. Ayan, thank you po. Okay lang po ba? Okay po. And then, yun po, kapag po sinabi po ng patient na iinumin ko mamaya, so remain with the patient until the medication is swallowed po. Or never leave the medication at the patient's bedside table. And then next is to assist the client in a comfortable sitting position or secure the side rails. So, itataas na po natin yung side rails para ma-secure po yung safety ng ating patient. Comfortable na po ba kayo sa ganyang position? Okay po. And then, next is to dispose or use materials and arrange the reusable ones. And then, ayan po. And then, dispose, ayun na po, na-dispose na po natin. Remove PPE if used. And then, perform hand hygiene na rin po. Tapon na po natin. And then, don't forget to assess for the effectiveness of the medication given. Ayan, so after 30 minutes po, balik po tayo. And then, next po is to document the findings po. Document the procedure done, or the administration of the medication immediately to the client's record, including the client's reactions of the medications after the administration. Yan, so the medication is given orally. Ayan. And then next is to evaluate the patient's response to medication within appropriate time frame. Thank you po.